the massive majority of low back pain is secondary to a better term called mechanical low back pain. The insults will begin to outweigh the ability of our reparative mechanisms to protect you from the development of inflammation. But the disc is really quite structurally compromised. It's painful, it's inflamed. Good afternoon everyone, how are you going? David Johnson here from the Back Pain Centre and the Functional Movement Training Centre. Today I want to have a bit of a chat with you about an interesting topic called cyclic loading. And how did this topic come to mind? It's interesting because this week I've had 3 engineers come to see me. 3 engineers. One of them was specifically a mechanical engineer, so it was very interesting and enjoyable talking to these 3 patients because we were able to relate a lot of their spine pain to biomechanics, and biomechanics actually plays a fairly important part in understanding back pain. And in the old days, we actually used to refer to back pain as mechanical back pain. More recently, that term has sort of gone out of favour. I'm not really sure why it's gone out of favour, but the massive majority of low back pain now is unfortunately being referred to as non-specific low back pain, and that is a very bad term because it really means that people are shrugging their shoulders saying, well, we don't really know what's causing this back pain, so we'll just use the term non-specific. But in actual fact, the massive majority of low back pain is secondary to a better term called mechanical low back pain. And if you have mechanical low back pain, then it's very clear that in order to sort the issue out, the solution is going to be a biomechanical solution, which of course is why functional movement, which focuses wholeheartedly at 100% specifically and distinctively on movement proficiency, which always comes back down to biomechanics. That explains why functional movement therapy is unique and effective at addressing this biomechanical back pain. And biomechanical back pain comprises probably 90 to 95% of the back pain that exists in our society. So why have I talked about cyclic loading? Well, these engineers that I talked to this week really were able to understand biomechanical stress. And I sort of started talking to them about this by giving this example. If I have a piece of plastic or a piece of metal and I continue to flex and bend this non-biological structure repeatedly and accumulatively, maybe after a few minutes I'm going to end up having 2 pieces of plastic because the biomechanical stresses that occur right there will eventually accumulate and cause weakening of the structure, and you'll end up having 2 pieces of plastic. Now, when it comes to our spine, our lumbar spine, if we bend and flex through our lumbar spine, we will also be imparting a biomechanical stress into our lumbar spine. Now, why the lumbar spine doesn't sort of break in half is that it's a biological system, not a mechanical system. And there are always attempts to repair the insults that occur in our body. But over time, if you continue to drive biomechanical stress into your musculoskeletal structures, and in particular our spine, the insults will begin to outweigh the ability of our reparative mechanisms to protect you from the development of inflammation, and as a consequence of inflammation, structural breakdown, and the pain and disability that goes along with inflammation and structural breakdown. And so really we should be thinking about our spine as being a support strut as opposed to a structure that is flexing and extending, flexing and extending. And if we think about the way that the spine should move, we should be thinking about it being in neutral position with hip-centric rotation. And that means that our rotation is happening down here at the hip joint, okay? It's about 3 or 4 inches below our lumbosacral junction, or our L5S1 or our L45. Right down here is our hip joint. And the hip joint is a ball and socket joint, so it's actually designed for rotation. Our lumbar spine is a support strut that is not designed for rotation. It is not meant to be going through these types of flexion extension type of movements as our default motor pattern. And so we should be thinking about that spine moving in neutral positions without that biomechanical stress being imparted on these lumbar discs. We want to have the rotation occurring down here in the hip joint, which is about here, not here. Let me show you now what happens, if you can see, if we ignore those biomechanical principles. We will start to get on our MRI scan these appearances. Here is a disc at L45 that is being subject to the accumulative biomechanical stress over many years of lumbar-centric rotation. Okay, and our spine doesn't like lumbar-centric rotation. Just because that's not hurting you at the age of 20 or 30 doesn't mean that it's not bad for you. It just means that at that age and at that point in time, your body is still repairing the insults that you're inflicting upon it, and it hasn't yet surfaced as a symptomatic condition, but it will. And you can see here now that this patient has got symptoms because she's come to see me, but the disc is really quite structurally compromised. It's painful, it's inflamed, and the structural changes are also causing neural compression. So the patient moves from just having back pain to also having back pain and lower limb pain, which we call sciatic pain. The nerve is an innocent bystander in the spinal joints because there's no other joints where the nerves are running straight through the joint. The spine is the only joint that has that sort of anatomy. So the nerves start to get pinched off as a consequence of being innocent bystanders, and all of it occurs as a result of this cyclic loading that these engineer patients of mine were talking to me about, and they know all about cyclic loading in engineering because they assess cyclic loading mathematically with compression forces and tension forces, which eventually destroy non-biological systems like scaffolding and support beams and things like that. Okay, so that's well understood, and it is very important in human mechanics or biomechanics. So that's one way of observing cyclic loading. And we can also see cyclic loading with functional type scans, and this is a nuclear bone scan, and you can see the effects of cyclic loading on joints here that are inflamed. And although these type of scans may be very specific and not always sensitive. When they are positive, it does show this biomechanical principle of cyclic loading with inflammation and pain stemming from these joints that are not meant to be doing those type of movements. So when you come to see me with mechanical back pain, I'm going to talk to you about how we retrain your biomechanics. And of course, if we're going to retrain biomechanics, we need to get your rehabilitation away from the couch. We need to get your rehabilitation away from lying down on the floor and doing core strengthening or range of motion or stretching type of rehabilitation, because that immediately eliminates your ability to acquire skillful movement. And that is the ultimate goal of effective rehabilitation, is to improve your skill, improve your biomechanics for activities of daily living, so that we can eliminate this repetitive cyclic loading that everyone who has back pain is unknowingly stressing their spinal joints with. Okay, so hence why NeuroHab is such a valuable and essential part of rehabilitation for back pain. Thanks for listening. I'll see you next week. Bye.